भी फिजियोथेरेपी क्लिनिक में आजकल अगर हम जाएं तो सबसे ज़्यादा केसेस हमें ऑर्थोपेडिक कंडीशंस के मिलते हैं. Even in the research, it has been found out that nearly 72% of the cases are of some or the other orthopedic condition, and the most common are obviously the joint ones. Today we have with ourselves Dr. Harjoban Singh, who will be sharing his insights over knee and shoulder arthroscopic surgeries and their demand. Mostly these cases arise due to the recreational activities जो आजकल हम लोग बहुत ज़्यादा indulge करते हैं, especially the youth. There occurs shoulder or knee injuries, and what we are going to discuss today is one of the major injury, that is an ACL injury. So doctor, can you throw a light on what is basically an ACL injury and how does it occur?
See, ACL, as we call it, anterior cruciate ligament, it is the most commonly injured ligament of all the ligaments in the body, and it is one ligament for which surgery is done most commonly around the world. So out of 4 ligaments in the knee, 2 are in the center, which we call cruciate ligament, anterior and posterior. So this is the anterior cruciate ligament, and most commonly it is injured either in sports injuries like in contact sports, football, cricket and all other sports, hockey, or it can also occur after a accident, road traffic accident, or some we commonly see some patients who get their ACL injuries while dancing in parties.
Okay. So
these are the most common problems.
Right. तो जब suddenly एक ACL injury हो गई किसी को, then what do you suggest? How can a patient get up from the bed?
See, the first symptom the patient will feel is something has given way inside his joint. Sometimes patient complain they have heard the ligament break, so they feel a click, and the immediate presentation after the injury is pain, as well as knee joint gets swollen.
Knee joint gets folded.
Swollen.
Okay.
So there is swelling around the knee, there is pain, the patient has difficulty in moving, patient has difficulty in bending his knee.
Okay.
So the first thing they can do is just apply some ice packs to reduce the pain and swelling. They can use crepe bandage at home. Before these measures I'm mentioning before they see a specialist. So they can do rest, they can apply ice, they can apply a compression bandage like a crepe bandage.
Pain management के लिए techniques आप बता रहे हैं. Okay.
So the formula is RICE, rest, ice, compression and elevation. So these things are simple measures which they can do at their own places before they actually get an appointment and go and see a specialist.
Okay. So can you also let us know कि क्या milestones हम basically achieve करते हैं through the arthroscopic surgery that we perform once?
See, after an ACL, the major complaint in an ACL deficient knee or an injured knee is instability. Pain also is part of the initial problem. After some time, after a few weeks after the injury, the patient is not having pain in his knee. The only complaint he has is instability. Instability means knee is not stable. He doesn't feel like twisting or running or playing sports. He feels that knee will give away. So that is the major complaint. And by doing ACL surgery, we are going to repair that ligament, either repair or reconstruct. So both are different. So by this surgery, we are going to make the knee stable again.
Okay. So
he will have a natural feeling in his knee as he had before this injury.
Okay, so you have conducted more than 5,000 surgeries, as you were saying, joint replacement as well as arthroscopic surgeries. What I would majorly want to know that what is the solution which is most addressed when the challenges are witnessed by the individual post the surgery?
See, most of the time these patients undergo ACL reconstruction surgeries if they don't have any other associated injuries in the knee. By associated injuries, I mean the meniscal injuries or the cartilage injuries. We are just focusing on ACL today. So after undergoing just ACL reconstruction, there are not many restrictions to be placed on the patient after the surgery. We allow our patients to start full weight bearing the day after the surgery. They can move, although they will have some discomfort or pain from the surgery, but not any restriction that they can't put weight. They can put weight on their knee. The movement gradually improves over a period of first 3 to 4 weeks. By the end of 1 month, the knee is most of the time regains full range of motion.
Okay.
And other milestones we achieve are, see, most of the patients ask when I can start driving. This is a very common question asked by most of the patients.
Right, driving.
So driving, most of them start by 4 to 6 weeks. Running and jogging activities, they can start after 3 to 4 months. And going back to their professional sports, it takes usually 6 to 7 months. So there's no fixed formula.
Okay.
So this is a range I'm telling you, because every patient is different. So they have to undergo a specific period of rehab. So it all depends when a patient is fully fit and ready to go back to his sport. So it all depends on his muscle strength, his ability to go back.
Right. So in this very scenario, अभी जो आपने कहा है that people are getting fit after 4 to 5 weeks or 3 weeks, so there is a designated period of time जो लगता है हर individual को recover करने के लिए. तो I wanted to know कि ये एक अगर हम myth bust करें कि क्या एक इंडिविजुअल अगर सोचे उसने सर्जरी करवा ली, ही इज़ रेडी टू मूव आउट एंड ही इज़ फिट एंड फाइन, क्या ऐसा होता है? और अगर ऐसा नहीं है तो उस चीज़ के ऊपर आप क्या कहेंगे?
See, this surgery is done to take the patient back to the status where he was before this injury. So if he was a professional football player, he should be able to return to football. If he was doing some other heavy activity, heavy labor, he should be able to go back to his original work.
So what according to you are the best solutions to address the challenges which are witnessed after the surgery?
See, surgery is just one part. So after I've done my surgery, I always tell my patient that 50% of the job is done, but 50% is to be done with the help of physio and my rehab team. So why I say this? Because ligament has been reconstructed, but the patient should be able to protect this ligament till the time this ligament is fully incorporated into his system.
Into the body.
So for that, a good muscle strength is very important. How do you build your muscle strength? With your rehab. So this is very important, to undergo a regular rehab during the post-op period. So by regular rehab, I mean you have to achieve certain goals in certain periods of time. So this way you can strengthen your muscles, you can build your endurance, you can build your proprioception, so that not just your ligament but overall your fitness improves, and that helps in preventing re-injury to the ligament.
Right. So that is better for preventing the re-injury.
Yes, that is better for getting back to your pre-injury level of activity and the prevention of future injuries.
Also, I would like to conclude this entire interview by asking you one specific question. After the surgery that has been conducted, what are the tips that you offer to your patients who have got the surgery done?
See, initial rehab period is very important.
Right.
So they have to be compliant with what I tell them. I tell my patients, or my rehab team or my physiotherapist tell my patients. So they have to comply with the instructions.
Okay.
So instructions are very specific, what not to do and what to do. Once they are, we have given them a fitness that you can go back to your sport. So after that, the most important part is to prevent injury. And injury prevention is also a very important goal achieved by the rehab.
Right. तो फिर do's and don'ts क्या रहते हैं इसमें?
See, in football, there's a program named FIFA 11 Plus. So the goal of that program is it is followed all over the world, and most of the soccer teams, international players, they undergo this set of exercises, 11 exercises.
Okay.
So FIFA 11 Plus is the name, and they found out that after the implementation of this simple program of exercises, 11 exercises, the ACL injury rate has gone down to the tune of 70%.
Wow, that's
So
nice.
You can only understand that just by doing some exercises you can prevent the injury by 70%.
Right. So basically, it plays a part in conditioning your joints as
Yes.
well as it.
It conditions your joint, it trains your muscles,
Yeah.
it improves your proprioception activity and proprioception sense of the
Okay.
joint, so
Okay.
that even in your subconscious mind, your joints are stable.
Okay. Okay. So, with this very session, we have got to know very good insights upon what is an ACL surgery and how physiotherapy and rehabilitation can help a person to get back to life and rejoice it completely without any limitations. Thank you.